History of Policy Regarding the Healthcare System by Mitch Dubnicka and Stephanie Gangland.
The major policies that will be discussed during this presentation are the new and fair deals, Medicare and Medicaid, the Patient Protection and Affordable Care Act, and the possible future policies.
Important health insurance reform began in the 1930s during the New Deal and continued in the 1940s during the Fair Deal. Both President Roosevelt and Truman pushed for a national healthcare system. Although neither got it to pass, there were small victories. President Roosevelt passed the Social Security Act in 1935, which provided matching funds to states for expanding public health and maternal and child health services. Truman passed the Hill-Burton Act in 1946, which gave nursing homes, hospitals, and other healthcare facilities loans and grants for construction and expansion, as well as prohibiting discrimination of patients when seeking hospital services. In 1965, President Johnson added Medicare and Medicaid to the Social Security Act, which included three different parts. Part 1, Medicare Part A, was to bring pay for hospital care, limited skilled nursing, and home health care. Part 2, Medicare Part B, gave optional pay help for physician care. And Part 3, Medicaid, was a program to assist states in covering long-term care for the poor, as well as provide health insurance coverage for certain classes of the poor and disabled. Medicare and Medicaid provided hospital and medical insurance for Americans 65 and older, funded entirely by the federal government, and around 19 million people were enrolled in Medicare in 1966.
The Patient Protection and Affordable Care Act was created by Congress and President Obama in 2010. The Affordable Care Act aimed to solve several key problems in the current healthcare system. The first problem was a lack of access for healthcare for many citizens. The number of people without insurance was simply too high, and this created quite a burden on the number of people who were paying for health insurance in the form of higher premiums. Since the Affordable Care Act was put into effect, about 5% of the country has gained health insurance, being reduced from 15.7% of citizens prior to the Affordable Care Act to currently about 10%. The second main problem was healthcare was simply too expensive. Healthcare traditionally has been focused on tertiary medicine or treating diseases once they have already manifested. The Affordable Care Act aimed to transition from tertiary to primary medicine, meaning preventing disease rather than treating disease. Since the Affordable Care Act was signed into law, the routine examination rates have increased 3 to 5% based on which type of examination it was. Finally, the Affordable Care Act aimed to reduce spending on healthcare. It done this by making the healthcare system more efficient and reducing administration costs. It's very difficult to determine exactly what Congress will pass and what goals they will have for the healthcare system. With the president changing from Barack Obama to Donald Trump, it is especially difficult as the Affordable Care Act may or may not continue to be in effect. But something will definitely be done in the future. Future policy will definitely be made by Congress, and in our opinion, the healthcare system will likely focus on preventative medicine as it creates a more efficient and less costly healthcare system.